Hello, I'm Dr. Carlos Sanchez, and today I want to speak to you about 3 or 5 daily habits that can lead to long-term health benefits. So let's talk about them. I think one of the habits that's very important could be, and is actually, good sleep. Okay, that is vital to anything we talk about for health, short term and long term. And the amount of sleep is important. It could be 6 to 8 hours, but it's the quality of sleep and the consistency of having this pattern throughout our daily life. So sleep is very important for our body and our mind to rejuvenate and regenerate for the next day. Another habit that's very important, I think we all need to be active. So we need to be conscious of moving around during the day, whether it is exercise and going to the gym and doing 30 minutes, or just taking the stairs instead of the elevator up to your work or home. We have options every day to move or to stay still. And the more we're active, the better for the heart, better for the brain, and overall health. And number 3 is, of course, being conscious of what we put in our bodies, and our food intake and our meal planning, and whether we're eating large meals. Look at the portions, look at the food we're eating, and think about it in the long term. Sure, we're human. We can always make a little mistake here and there, and we'll compensate for it. But try to be conscious of what we're eating, and avoid the fast foods, avoid the greasy foods. And one more thing that's very important for long-term health, that sometimes doesn't get enough attention, is socialization. We really need to be more social with friends, families, and new acquaintances. Being social means sometimes picking up the phone and speaking to people that we haven't spoken to in a while, and re-nourishing those friendships. It's very important for health. So how much protein do we really need, and are we overdoing it and getting too much? Well, this is a good question because people today are enraged with eating a lot of protein, especially before working out. And it is important. Protein is certainly a macronutrient that we need in our diets. And for those that are trying to perhaps lose weight, we should increase our protein content to around 50% easily would be a safe amount. And protein is also very important, for those days or before we go to the gym and work out and do a strength training, for example. We should have some protein before doing that. The quality of the protein is important. Sometimes, meat has a higher quality protein than vegetables. Even though vegetables do have some protein, the protein in meat tends to be more effective for muscle development. I think, we can't lose sight of a balanced diet, but we can increase our protein content up to a 50% amount, and we can do that when we need it. Again, like before a workout, we don't necessarily need to have a large protein content every day. We can do it on alternating days as well. So what is the healthiest breakfast meal we can have? I believe there's several, but one in particular that checks all the boxes is, for me anyway, but I think for a lot of people, could be a good grain toast with fresh avocado and eggs. And eggs, that has your complex carbohydrates with grains, your good fats with the avocado, and eggs for protein. You can also drizzle a little olive oil in there. And this also serves to kind of make you feel satisfied for a longer time than just eating something sweet or carbs in the morning. So it really serves a great food choice to get you through your next meal, which will be lunch, but you won't be hungry before that. What are some myths regarding weight loss? Well, I think one myth is that we all need to go to the gym and exercise for 2 hours a day. Exercise is very important, but the truth is your diet is the most important factor regarding weight loss. It's the amount of food we eat and the quality of food. Number two, I'm always going to be heavy because of my genes. True, genes do have some effect of your weight and your metabolism, but that can be changed or improved by diet, your environmental choices, and activity. So we can overcome our genes to some degree, and that's called epigenetics, how we influence them. So good healthy habits can make a big change. And number three, I can take one medicine and I will be, it's all I need for weight loss. And you know, the fact is we do have some very good medicine today for weight loss, but it's not going to do the trick by itself. Accountability needs to occur, and patients need to incorporate lifestyle changes, and that involves following the proper diet, good sleep, being more active, socialization. There's a lot of different things that the patient needs to incorporate into their life to make it possible for them to sustain the weight loss even after that medicine is discontinued or stopped. So there are a lot of different diets out there. Which is the best one? So the fact is that every diet has some benefit. And when you compare all diets, you know, if you follow them, chances are you'll lose weight. But the truth is you also need a diet that's realistic and sustainable. So you need a diet that's going to fit your lifestyle, what works best for you. And that is going to be different than the next person or the next patient. You know, you have to see, you know, what foods you like that can be healthy, how often you're going to eat, and what else you're going to incorporate with your diet to achieve your goals. But there's not one particular diet that's going to be great for everybody. So next time you see your doctor, you want to ask, what is the best diet? Look around, check what's best for you, and try to know the calories and the macronutrients that you are eating, such as the protein, carbohydrates, and fats. And if it's a lot of work for you, you can also ask somebody else to do it. And there are services out there today, such as meal planning, delivery services, that can make these meals for you. And you won't have to worry about that lunch or dinner that's sometimes difficult to arrange and plan. So it's possible. Thank you.